So you're pregnant and you know that in pregnancy you need not only prenatal vitamins, folic acid, but calcium and vitamin D as well. So your question is, how much calcium should I take during pregnancy? Now, the requirement of calcium changes depending upon how far pregnant you are. But remember, calcium is so important whether you are pregnant or not pregnant. You should get extra calcium because calcium is very important for your skeletal growth. Now, as the baby grows, the baby needs calcium also for not only for the growth of the baby's bones, teeth, muscles, nerves, a lot of tissue. So calcium requirement is about 1000 milligram of calcium per day for most of the patient. Again, it depends upon how much calcium store you have in your body. Now, our body is very interesting. The way it works is that if your baby needs calcium, then it's gonna take it from you. Even if you don't have enough calcium, it's gonna take it from your reserve in your body. So you will get depleted. And if your calcium reserve get depleted, then you could have a risk of getting bone loss, we call osteoporosis, if you don't take extra calcium supplementation. So really important to start taking calcium supplementation as baby starts growing. You should take it from day 1, but at least from 14 weeks and continue it at least 6 months postpartum. Because after the baby is born, you're going to be breastfeeding, and a lot of that calcium is going through the breast milk to the baby. So how much calcium is it in different food items? Let's think about it. The best source of calcium is plain yogurt, just a non-fat plain yogurt. 8 ounces of it will have around 400 to 450 milligrams of calcium. Milk is a good source of it. It could be skim milk, it could be 2% milk, it could be even soy milk. 8-ounce glass of milk will have up to 300 milligrams of calcium in it. Cheese is a good source of calcium. Lots of greens, even black eyed beans have got a lot of calcium in it. So look into that and see how much calcium you are getting it from your diet. But also the prenatal vitamins have calcium in it. Not enough to give you the whole 1000 milligram, but usually around 300 to 350 milligrams or so. So add that together and make sure that you're getting enough calcium. Now, if you are lactose intolerant or you're vegan and you cannot do dairy and your prenatal doesn't have enough calcium, then look into the supplementation. Most of the calcium supplements which are available on market is calcium and vitamin D together, and usually have about 500 to 600 milligram of calcium in it. So if you take 1 prenatal vitamin and 1 calcium supplement, that should be enough for you. But just remember to continue your calcium supplementation even after the baby is born for at least 6 months, so you get your reserve back to where it was before you got pregnant. Enjoy your pregnancy.